Well, you're wonderful. I don't need, all I need to do is stand up here and you're quiet. That's great. I wish my class would respond so well. Anyway, it's wonderful to see everyone here. I think everyone understands how important these hearings are. This is the fifth of these cost trend hearings, the second that the Health Policy Commission, working with our sister and brother organizations, CHEER and the Attorney General's office, have been putting together. I know how busy everyone is, and so I really appreciate it, and I really appreciate my fellow commissioners. I think everyone knows by now who the commissioners are, so I'm not going to go and introduce them. They can feel free when they get the mic to do that. We're very fortunate not only to have the benefit of our leading healthcare people in the delivery system, the insurance system, the consumer supporters, but also our governor is going to be joining us, and we've been working hard, and I really want to thank our staff for the amount of work that they've put in to make this happen. So we've been working hard to find the best and the brightest from outside the Boston area to come and join us. But as you will see, even though we had a nationwide search, several of our key outside people are from the Boston area. I wonder why, and I think it has a lot to do with where we live. I have the opportunity to spend a fair amount of time around the United States and occasionally around the world. And I want to say this, I'm just proud to be part of Massachusetts and the Boston area. What we're trying to do is sort of like threading a needle. We have a first-rate healthcare delivery system. And the people who work in it, I know, are very committed to it. And they're all trying to do the right thing. And yet, in the process of doing that, we also have to make sure that we do it in a way that our citizens and our government can afford. So we want to keep our spending in line with our capacity to spend, our income, and yet to do that while improving quality and access. And that is no easy task. So that's what we're all about. We're not interested in just saving money, but we do need to recognize that if we're going to have a long-term sustainable healthcare system, we need to do it in a way that we have the capacity to so afford it. So first, let me thank Renee Landers, who is a professor of law, and more importantly, the director of the Health Law Concentration at Suffolk University. This is a truly wonderful venue for our proceedings, and Renee, thank you for letting us come here. And if you'd be good enough to give us some opening remarks and get us going, I'd appreciate it. Thank you. Yeah, come on, join us.
Well, good morning, and thank you very much, Dr. Altman Stewart, for your kind introduction and your kind statements about our university. As Stewart said, I am the faculty director of the Health and Biomedical Law concentration here at Suffolk Law School, and it's really a privilege for us, our privilege, to be able to welcome you here to Suffolk University, the Health Policy Commission, and the members of the public who are interested in the work of the Commission for this 2014 Cost Trends hearing. It's really a distinct honor to be able to host this important part of the Massachusetts process for understanding how to deliver cost-effective, quality care to everyone in the Commonwealth. We are very pleased and honored to welcome Dr. Altman, the members of the Health Policy Commission, Governor Patrick, representatives of the Attorney General's office and the legislature, and many distinguished experts in healthcare law, healthcare policy to our institution today. As Stuart indicated, alluded to, it is especially appropriate that you're here because the focus of one of the areas of focus in the curriculum of the law school and the university is on health law and policy and healthcare administration. At the law school, we have a rich curriculum covering a wide range of areas in health law and policy, and the resident faculty and the adjunct faculty bring a wealth of education, research, and practical experience to the learning of our students. Some of our students come from backgrounds in the sciences and health professions and make their own contributions to the educational process here. We also have internships, a health law clinic, an academic journal, the Journal of Health and Biomedical Law, and the National Health Law Moot Court Team. Who knew there was such a thing, right? Our alumni are national leaders in the field. We, among them, are the former General Counsel of the United States Department of Health and Human Services and the Centers for Medicare and Medicaid Services, partners in national law firms practicing healthcare law, and really distinguished practitioners in the public sector, people who've worked in the legislature, staff members at the Commonwealth's Connector Authority, one of the officials in Vermont who's leading the effort to work toward a single payer system in that state, so maybe they will outdo Massachusetts at some point in that regard, and even members of the